Hi, my name is Phil. I like to talk about politics. In this video, I'd like to discuss some of the government's more ridiculous lies in the current emergency and wonder what it is that they think they're gaining by them. But first, if you'd like to be notified of daily news and politics, then please subscribe to the channel and click the bell notification icon. So, kicking off with the ventilators first, there's several of the most egregious lies surrounding this. So the first was our non-inclusion into the EU's procurement scheme. So when Downing Street were asked why we weren't getting involved in this huge bulk buying exercise of medical equipment that we were desperately lacking, they said, well, we're not a member of the EU anymore, we're going to do things our way. Then I think someone thought better of it and hang on a minute, there's going to be a load of deaths here resulting from our lack of equipment. And then they decided, actually, we should probably just say that we didn't know we could join. So the government played dumb and said that they'd missed the email inviting them to join the scheme. Now, this was a blatant lie for three increasingly compelling reasons. The first of which is, even if individual ministers are ignorant of the details of the transition period, senior civil servants in the Department for Health at least would have been explaining that we could be involved. That's what the transition period does. Although we're not members anymore, we'd still get access to everything. Secondly, the offer was being reported in the national news. I saw it. So if I saw it, I'm pretty sure the government saw it too. And third, earlier this week, minutes were being shown to journalists of meetings where the UK was involved in discussing these procurement plans, and the UK was showing interest in joining it, the first of these meetings being back in January. But even after the story was fabricated of the missing email, Michael Gove, a senior minister, was still saying that the reason they didn't join is because they want to do things their way. So ministers were not even coordinating their lies. This also posed a problem earlier this week when Grant Shapps, a Tory MP, and said that you mustn't go to the supermarket once a week. When people were discussing what do the regulations actually mean to us, can only go to the supermarket once a week. The government were quick to clarify that actually no, the regulations don't say any such thing. This was important because there's already been a bit of a backlash of complaints that a small number of police have been potentially overstepping their remit with the regulations, but at the very least not communicating what people can and can't do. The last thing we need is mixed messages coming from the Conservative government right now. But this lack of coordination is also symptomatic of the way that Boris Johnson is dealing with government. There isn't really any coordination. He's attempted to centralise everything around Downing Street, but then ministers are off doing their own thing because they're not being brought into that. But if the ventilators email was a demonstrable lie and an example of poor coordination on the public message amongst ministers, the more recent one was even more ridiculous. So Robert Jenrick, another Tory minister, was telling Sky News that we had 12,000 ventilators in operation in the UK. Now, that was news to me, because I was explaining last week how we had 8,000 and that the NHS was saying they're going to need another 20,000 to deal with April. I knew we hadn't ordered any more as of last week. I don't know about this week, but as of last week we hadn't. And it would have been surprising to say the least if we'd suddenly managed to acquire 4,000 more, because it takes some time to manufacture. I wondered if they'd been requisitioned from elsewhere, because my mind was going back to earlier in the emergency. The NHS were given more ventilators that were being used elsewhere, including in vet medicine. And some people were trying to bill these as new ventilators that had suddenly been built overnight, when they were actually existing ones moved from one place to another, some of which had probably been down a dog's throat at some point. But Jenrick, leaving the Sky News studio, where he'd said we had 12,000 in operation, went across to the BBC, and therefore a short time later, just later that morning, was now saying we had 8,000 ventilators. The number I know to be accurate. So what happened? Did the NHS get 4,000 ventilators delivered that turned out to be made of, candy or something? Or did they all explode and someone had to go, oh, Mr. Jenrick, sorry, those new ventilators all exploded. You better say we've only got 8,000 now. No. Why did he say 12,000 to one interviewer and then 8,000 to the very next one? Not even a different day, same day. And at a time like this, it's incredibly important that the government are presenting a clear and open message about what's going on and what's been done to improve things. You need to be able to explain to the people, this is where we were, this is what we've done, this is where we are now. Then you need to be able to say, so now this is what we're going to do and this is where it's going to put us. You need to bring people along on this journey. It's absolutely essential because there's too many people in society that just leave things to the government. Something terrible happens, the government will sort it out. Something terrible's happening now and there's lots of people think the government are sorting it out. That's foolish at the best of times, that assumption. But at the moment, the government, even a good government, couldn't sort this out on their own. They need us. They need society to actually get involved in it. We've seen that in other countries as well. We have to become engaged. That's not happening without a clear and open message. And yet the government are lying to us in such an obvious way that not even their most ardent supporters would be able to justify it. It's very much like the testing. So the government were proudly proclaiming that we were testing 10,000 people a day. We're doing it. We're testing 10,000 a day. Then when they were pressed on the issue, it turned out we've been testing fewer than 8,000 a day. They were asked about this discrepancy. We've got the capacity to test 10,000 a day. As if somehow there isn't the demand to meet the capacity. I mean, the ideal is testing 66 million a day. That's not feasible. You can't get anywhere close to that. Of course not. So what you at least should be doing is testing everyone who goes to a hospital for whatever reason, because that's got to be an absolute hotbed, as well as testing anyone in a household where people have showed symptoms. Simple as that. And it's a practical as well as a moral problem. If people die from the virus outside of hospital, they haven't been tested, and so it's not counting on the figures. So even our number of deaths is not the real number. The real number is higher. We just don't know how much higher. This is denying us vital information. We already know that the number of cases is a completely useless statistic. Even in a country that's doing a lot of testing, it's not great because you still don't know the real number. But you ought to at least know the number of deaths, and we don't. We will never beat this thing without information. It's what all the experts who've dealt with past pandemics have said. Until you are tracking the virus, you will not stop it. We're not even tracking properly where it's been, much less where it is now. So when we're told that we'll soon be able to test 25,000 a day, what are we going to believe when they announce that we're doing it? Will it be another case of testing far fewer and falling back on the capacity argument? And also, they keep missing their own deadlines anyway. They keep setting these deadlines for testing targets and missing them. I mean, that really is the limit of incompetence, isn't it? When you can't even meet targets that you're going to lie about anyway. So they're not even competent liars. And these lies are utterly pointless. Yes, it may buy them some political capital. In a political situation, I can see how lying helps. This is unfortunately why politics attracts so many effective liars. But this isn't a political situation. You know, when the deaths keep on increasing, when people's loved ones are unable to get the medical treatment that they should due to a lack of beds or ventilators or any other resources, when more NHS staff start dying because of a lack of PPE, people are going to be less than impressed with these proud boasts. You know, they're not going to be impressed with what the government's planning on doing. They'll want to know why they didn't do it months ago. And it's also been reported that NHS England have warned all NHS staff that they will face disciplinary action if they report on health and safety in their hospitals. So again, they're trying to suppress information about lack of PPE and lack of health and safety in hospitals. Now, I can understand most staff being affected by that cowardly policy. I would absolutely understand ancillary staff, nurses even, having to go, right, we can't talk about this. Yeah. But I'll be honest, if I were a doctor, I'd be doing it anyway. See what it does for their PR if they have to sack a doctor in the middle of a global pandemic for whistleblowing on appalling conditions in a service that's already buckling and having to answer questions about unfair dismissal in a public employment tribunal. I would bluff them on that one. And I know it would happen because it's happened in America. A doctor has been sacked for refusing to take down social media posts explaining the lack of health and safety in their hospital. But that's what I would do. That would be a PR disaster for them. And we do need this information. We can't be suppressing this information. I know most people don't follow these things especially closely, but whenever if you study scientific related or health related disasters, It's always made much worse whenever people try to suppress information. You know, as bad as a situation is, it's always made worse by trying to suppress information, and it's always made better by releasing that information, because then you're keeping people informed and someone will come up with something useful. But anyway, I hope you found the video interesting. If you did, don't forget to click the like button, and if you'd like to support the channel further, then please also click the Patreon link for details. And until next time, I'll see you later.